So, where's the line? The one between your personal freedom and the government's job to keep everyone healthy? It's a really tense and fascinating question, right? And it's at the heart of so many debates today. So, that's what we're going to dive into.
Okay, let's start with something super simple. Why does the government care if you wear a seatbelt? I mean, it feels totally personal, doesn't it? It's your body, your car, your risk. So why on earth do they make it a rule? Well, that one little question, it basically unlocks this whole big ethical puzzle we're going to get into.
To really get a handle on this, we've got to go back a few decades. Because, this whole debate didn't just pop up out of nowhere. It actually grew out of this huge shift in how we think about what makes us sick and what keeps us healthy in the first place. Yeah, for the longest time, public health pretty much meant fighting germs, infectious diseases, or making sure the water was clean. But then, in the 1970s, the focus started to pivot. Big, influential reports, like this one from Canada, started pointing the finger in a whole new direction. At our own behavior, at the self-imposed risks we take every single day. And just a couple of years after that, the conversation got, well, a lot sharper. This writer, John Knowles, he did not pull any punches. He basically framed it as a choice. Either we take individual responsibility or we face social failure. And this is a huge turning point, right? The whole argument became that our choices, they aren't just personal anymore. They have these massive ripple effects on society and the economy. So, this new focus on what we do, well, it immediately clashed with one of our most deeply held beliefs, the right to choose for yourself. This idea has a name. It's called autonomy. And it's like a big philosophical wall that says, hey, government, stay out.
So what is autonomy, really? Well, the core idea is pretty simple. It's that you are the captain of your own ship. You have the right to make your own calls about your own life, even if other people or even the government think those choices are, well, kind of dumb or bad for you.
And this sets up a huge conflict. On one hand, you have autonomy, which says the government needs to keep its nose out of your business, especially for self-regarding acts, things that only seem to affect you. But, on the other hand, you have this idea called paternalism, and that's the argument that sometimes the government should step in, not to be a nanny, but to protect you from choices that maybe aren't as free as they look, like if you're being misled or dealing with a serious addiction. And that leads us right to the big counterargument, the one that totally shifts the conversation. But what if those private choices aren't really so private after all? Okay, this is where things get really interesting for people who support government getting involved. It all comes down to this idea. The choice might be yours, but the bill, well, the bill often ends up with everyone else. It's pretty simple, really. No choice is an island. The idea that you can make some risky decision and it won't affect anyone but you, from this point of view, that's just not realistic, especially not when we all share things like healthcare systems and insurance pools. Let's just trace this out with our seatbelt example so you can see how it works. Okay, so one person decides not to buckle up. Then, boom, an accident happens. They get seriously hurt, injuries that probably could have been avoided. What happens next? Well, suddenly it's public resources getting called in, ambulances, ER doctors, long-term hospital stays, maybe even disability benefits. All of that, that's what we call a shared societal cost.
And look, this isn't just some abstract theory. The courts have used this exact same logic. This quote here from a real court case about motorcycle helmets is so powerful. It basically says, look, from the moment of that injury, society is the one that picks the person up off the highway. So it's an illusion to think only that person is affected. The second society steps in to help, it becomes a public issue. All right, so if a government decides, okay, we have a right, maybe even a duty to step in, how do they actually do it? I mean, what's in their toolbox for nudging us toward healthier choices? Generally, they've got three main tools. First, they can try to educate you. Second, they can make risky stuff more expensive with taxes. And third, they can just lay down the law with actual rules and mandates. Let's talk about those sin taxes for a second. Taxes on things like cigarettes and booze. The argument for them is simple, right? It makes the bad stuff more expensive, so maybe you'll use less. And the money helps cover the societal costs. But the argument against them is just as powerful. These taxes are regressive. That means they hit lower-income folks way harder, which brings up some really serious questions about what's fair. But then you get to the most controversial tool of all, the mandate. This is where the government stops asking nicely and starts demanding. And honestly, there is no better real-world example of this than the crazy back and forth over motorcycle helmet laws. So check out how this all went down. Back in '67, the US government got clever. They tied federal highway money to states passing helmet laws. And guess what? It worked. By '75, pretty much everyone was wearing one, and fatalities went way down. But then came the pushback, all centered around civil liberties and personal freedom. Lobbyists went to work, and in 1976, Congress backed down. And the result? Within just 3 years, 27 states had gotten rid of their helmet laws. So, what do you think happened next? Yeah, exactly what you'd expect. In the states that repealed their laws, helmet use just plummeted. You can see the drop right here. And the direct results of that? Fatalities and serious injuries started creeping back up, showing a crystal clear link between the law and what actually happens on the road.
Okay, so all of this brings us to a really powerful final idea, one that tries to flip this whole debate on its head. See, for decades, the debate has been framed like this. The starting point, the default, is individual freedom. So if the government wants to step in, it has to make the case. The burden of proof has always been on them. But here's the twist. The argument goes that, given the absolutely staggering toll of preventable illness and death, from smoking, from not wearing seatbelts, you name it, maybe we've been asking the wrong question this whole time.
And here it is, the big flip. What if the default position should be action? With so much suffering and such massive social costs on the line, maybe the burden of proof should be on the people who argue against doing more. Maybe they should be the ones who have to explain why we should stand by and do nothing.
And that really leaves us right back where we started, with that fundamental question that has no easy answer. Individual liberty versus the well-being of the whole community. When one is at risk, how much of the other are we willing to give up? Every society has to draw that line somewhere. The real question is, where do you draw it?